Hello everybody, I am Roberto Ferrari from the University of Ferrara, and I'm here to tell you that to have elevated blood pressure is bad. It damages the heart, the brain and the kidney. And the problem is that you do not feel the level of pressure in the pipes of your body. For this reason, hypertension or high blood pressure is considered the silent killer. This is because there is too much salt in your meal. So please, my message to you is please reduce the salt in your meal. Cook with less salt. Remember, this is an S.O.S. Step down with your salt. It's very important for your health. Of course, this can be done, and Dr. Sunaina will tell you how to do it.
Hi, I'm Dr. Sunaina, working as consultant nephrologist at KMCT Medical College, Kozhikode, Kerala. Thank you, Roberto Ferrari, for that introduction regarding hypertension. I agree with you that creating awareness about cut down of salt intake is very important in Indian population, because people in India are very unaware of the harmful effects of hypertension and how to cut down salt intake in their daily food intake. On an average, the WHO recommends a daily intake of 105 grams of salt per day for the healthy lifestyle. But on an average, our Indian population consumes about 10 to 11 grams of salt per day. So hypertension is one of the leading cause of very complicated diseases, because it is one of the most important lifestyle diseases which can lead to all sorts of life-threatening complications like kidney failure requiring dialysis, heart attack, and intracerebral bleed leading to stroke and all. So control of BP or hypertension is very important. There are various drugs available in the market to control BP, but the drugs alone will not help us. For the drugs to act properly to control hypertension, we need a very strict salt control. So I'll share with you some of the important steps or points or tips how to cut down salt intake in our daily food intake. So the foremost is, some of the Indian population and their families, they use salt. They add salt while cooking rice, while making dough for chapati, puri, etc. So first of all, you have to cut down that habit of adding salt to the while making rice and chapatis, etc. The next step is everybody is having the habit of adding salt to whatever salads they are taking, whether vegetable salad, fruit salad. In order to make it more tasty, people are having the habit of adding salt to it. So avoid that and try to consume that in their natural taste. And the third tip is avoid food which is very rich in salt, like puppets, pickles, cheese, yogurt, etc. like ketchup. All these things are very high in salt intake, salt content. So stop taking that. That is most important. And the next tip is that we all have the habit of keeping a salt shaker or bottle on dining table so as to add salt in order to get a more taste for food. So you just remove your salt shaker or salt bottle from your table. And the most important among all this is that you have to cut down salt very slowly, not in a hurry. You have to slowly decrease the salt intake daily and to avoid, you have to consume approximately 5 grams of salt per day, not to exceed more than that. So you have to slowly cut down the salt intake gradually. So if you follow all the steps, I think you can well control the daily intake of salt, so that the drugs also, along with this lifestyle, you can control hypertension.